Erectile dysfunction is the consistent or recurrent inability to either achieve or maintain an erection sufficient for pleasurable sexual relations.
There are probably about 20 to 30 million men in the United States who suffer from that. Longitudinal studies suggest that probably there are 600,000 new cases per year.
Erectile dysfunction affects all age groups. In fact, the Massachusetts Male Aging Study suggested that some degree of erectile dysfunction was present in 50% of men between the ages of 40 and 70. I've seen men as young as in their 20s. I've never really seen anybody below the age of 20. Certainly it's more common in older patients, but you will see patients in their 20s and their 30s. So it's not just in the older patient population.
For those who have erectile dysfunction, about 80%, 85% probably have physiologic erectile dysfunction, where 15% will have more of a psychological issue.
But I think it's fair to say that the overwhelming majority of patients have a combination of both psychological and physical factors, and one interplays on the other. If you're having some mild physical dysfunction, it'll cause anxiety and stress, which will have psychological effects and impact on sexual function as well. So there's a very specific consistent interplay between the two.
There are a lot of causes. The main causes are those processes that will affect the heart. So if you think about what are the risk factors for coronary artery disease, those are the risk factors for erectile dysfunction. Diabetes, hypertension, smoking, those are probably the biggest risk factors. Smoking is one that people can control, and that's when we really try to work with them. If they can discontinue smoking, they'll probably lower the risk of having erectile dysfunction.
Depression itself is considered a risk factor for erectile dysfunction. So you not only have the depression, but you have the antidepressants affecting function.
There are also psychogenic causes, which are probably in the long run easier to treat and not a permanent problem, but they're more likely to be reversible.
Generalized stress and anxiety is definitely a contributing factor. In fact, when we speak to patients about what they can do, I suggest stress relieving protocols and procedures, and not trying to have sex at those times when they're under a great deal of stress, because they may be setting themselves up for a disappointment.
Well, what happens is it's an interesting response that men will have. When they get into a situation where they may fail, they'll have an anxiety response. That anxiety will stimulate the sympathetic nervous system, and that's the fight or flight response. What that does is that response tells the body to not have an erection. It's getting ready to fight or to flee a scene. So it works against the body having an erection. So when a man gets in a situation where he's worried about failing, that part of the nervous system is stimulated. And the body tells itself, do not have an erection. And so man, when they get anxious, when a person gets anxious, it's going to be very difficult to have an erection. So that's probably what happens to the majority of men who have a psychologic or that type of erectile dysfunction.
It's a couple's disease. Communication between the two is very important. It's not uncommon that a husband will come in and say, hey, my wife's mad at me. She doesn't think I love her anymore. She thinks that my erectile dysfunction is because of lack of interest and desire and libido. So communication between both partners is very, very important. In fact, I always encourage my patients to bring their partner.
What usually happens, and it's always interesting when you have a husband and wife together, if you talk to them about what happens, they start out having some mild problems where man doesn't get as good of an erection as he used to. Now, any person does not like to be in a position where they're going to fail. So he starts to shy away from having any intimacy. The wife does not want to see him fail, so she starts to push herself away, and before you know it, they're not having any intimacy anymore. What ends up happening is after a few years, they're now not even affectionate at all, and they've lost that part of spark in their relationship. If they can get that confidence to go back and be sexually active, oftentimes they're very, very happy and very satisfied. So I think it's important to have the female involved with any therapy that you decide.
And here we get back to psychological issues. If the wife is flippant or expresses dissatisfaction or makes fun of the spouse's or partner's dysfunction, it's only going to increase his level of anxiety and stress, which will only increase his erectile dysfunction. So an understanding wife is very important.